This video presentation is about the effect of direct-to-consumer alcohol home delivery on alcohol-related online search behavior. This study was a cooperative agreement done in collaboration with the Centers for Disease Control and Prevention and the Center for Health Promotion and Disease Prevention at the University of North Carolina at Chapel Hill. What I share today doesn't necessarily represent official views of the United States government. Alcohol attributable mortality in the United States has been on the rise over the past 20 years, with a significant increase during the COVID-19 pandemic. During 2020 through 2021, an average of 488 people per day died from excessive alcohol use. The pandemic also led to shifts in alcohol consumption patterns, with more U.S. adults aged 35 to 50 reporting daily drinking than any year between 2008 and 2024. As alcohol consumption increased during the pandemic, so did alcohol sales. Between March and September 2020, retail alcohol sales surged by 20% compared to the previous year. Simultaneously, many states passed legislation to introduce or expand direct-to-consumer alcohol home delivery services, which I'll also refer to as DTC. In contrast, alcohol control policies that regulate alcohol availability and accessibility are proven strategies to limit excessive alcohol use and alcohol-related harms. Initial research suggests that using DTC alcohol home delivery during the pandemic led to buying more alcohol, drinking more often, binge drinking, and consuming more drinks per drinking occasion. These early findings highlight the importance of continuing to monitor the public health impacts of DTC alcohol delivery. Given that DTC alcohol home delivery is frequently accessed via online searches, we utilized Google Trends data to examine online search interest and DTC-related topics. Google Trends is a valuable tool for analyzing online search behaviors related to health topics. It has been used to study disease outbreaks and health behaviors, including the impact of alcohol policy changes on alcohol use and related health outcomes. As such, the purpose of our study was to examine online search trends related to alcohol delivery and alcohol-related harms during the pandemic across states with varying DTC policy landscapes. First, our research team identified search terms related to three broad themes: alcohol access, acute alcohol-related harms, and long-term alcohol-related harms. We selected alcohol delivery, alcohol poisoning, and alcoholic as terms to analyze in Google Trends. It's important to note that alcoholic is not a term used by the CDC or in the field. However, we selected it for its inclusion in this study because it is commonly used in online searches. The primary outcome in this study was online search interest, as measured by relative search volume. Google Trends provides a search term's relative search volume, which is normalized to the highest search proportion over a specified period of time. This allows us to compare search interest across different regions and time periods. Relative search volume ranges from 0 to 100, where 100 represents peak search interest. For the remainder of this presentation, I will refer to relative search volume as simply search volume. We extracted weekly search volume data from January 1, 2019 to October 31, 2023 for our selected search terms. The data were analyzed across four broad policy contexts based on states' DTC delivery policies. The first was no delivery allowed, then no change in delivery, new delivery, and expanded delivery. Given that Google Trends does not allow for multiple geographic locations to be selected within a single search, we extracted data for the most populous state within each policy context. No delivery allowed was represented by South Carolina, no change in delivery was represented by Pennsylvania, new delivery was represented by Georgia, and expanded delivery was represented by California. We examined the immediate and long-term effects of DTC policy implementation on search volume for our selected search terms. Policy shock refers to the immediate change in search volume during the week following DTC policy implementation, while policy trend captures the ongoing impact of search volume throughout the rest of the study period. Sensitivity analyses were conducted to account for time-based pandemic effects. These graphs depict trends in search interest for alcohol delivery in the new delivery and expanded delivery policy contexts. The red line indicates the date of policy implementation. As you can see, searches remained relatively stable over time in the new delivery context, while they spiked in early 2020 in the expanded delivery context around the time of DTC expansion. These graphs depict search trends in the policy context which did not introduce or expand their DTC alcohol policy. Searches spiked early 2020 in the state which allowed DTC alcohol delivery pre-pandemic and remained low in the state which never allowed DTC. We found a positive significant effect of time on alcohol delivery searches in the new delivery policy context, but no significant effects immediately or over time following policy implementation. In the expanded delivery context, search volume significantly increased immediately following policy expansion, before declining over time. No significant effects of time were found in the no delivery or no change in delivery policy context. Graphical depictions of search trends for alcohol poisoning suggest that search interest fluctuated over time and policy contexts. Analyses indicated a significant increase in search volume over time following policy introduction in the new delivery policy context, and a sharp decrease immediately post-policy expansion in the expanded delivery context. Again, no significant associations were found in the no delivery or no change in delivery policy contexts. Like the alcohol poisoning search trends, search volume for alcoholic fluctuated across time and policy contexts. Results demonstrate an increase in searches for alcoholic following DTC policy introduction and the new delivery context that continued through the remainder of the study period. Similarly, alcoholic searches increased in the no delivery context significantly over the course of the study period. No significant associations were found in the expanded delivery or no change in delivery policy contexts. Our results showed that online searches for alcohol delivery significantly increased immediately following DTC policy expansion in the expanded delivery policy context, before declining over the remainder of the study period. While there was no effect of policy introduction on alcohol delivery searches in the new delivery context, either immediately or post-policy introduction, searches increased over the entire study period. Familiarity with purchasing alcohol via DTC alcohol delivery may explain the immediate spike in alcohol delivery searches in the expanded delivery context. Additionally, preliminary research has shown that DTC was used frequently early in the pandemic and less so as lockdowns eased and businesses reopened. Given that the state representing the new delivery context first permitted DTC alcohol delivery in August 2020 when lockdown restrictions had largely been lifted, it may be that people were less motivated to purchase alcohol online versus in person. Online searches for both alcohol poisoning and alcoholic increased over time following DTC policy introduction in the new delivery policy context. These findings align with previous research demonstrating increases in excessive alcohol use during the pandemic. In contrast, searches for alcohol poisoning decreased immediately following policy expansion in the expanded delivery context. Given that DTC policy was expanded in this state mid-March 2020, heightened concerns about COVID-19 at the onset of the pandemic may have led to a reduced focus on other health issues, resulting in avoidance of medical care. While Google Trends provides valuable insights, it has limitations. Relative search volume does not represent absolute search volume, which may obscure the magnitude of search activity. Additionally, search results may be biased by cultural events and media coverage. Finally, our findings may not be applicable to states not selected for inclusion in this study, regardless of whether they have a similar DTC policy context. In summary, our study found that online searches for alcohol delivery increased immediately following DTC policy expansion in a state with pre-existing permissive DTC environment, before declining over time. Search trends for alcohol-related harms also varied by policy context. These findings can inform the direction of future research to monitor the longer-term effects of DTC alcohol policies on alcohol use and related harms.